Hi, everyone. Welcome back to the Sahara podcast. My name is Elia Rizvi, and I'm the Public Relations Coordinator here at Sahara. In this episode, we're going to be talking about mental health and the emotional side of aging. Specifically, we're going to be talking about all of the mental illnesses that are present in the elderly population, and we're going to be discussing some tips for our caregivers on how they can promote a healthier emotional and mental well-being in their clients. So without further ado, let me introduce you to our guest speaker today.
Hi everyone, my name is Saba Taqvi. I'm a licensed therapist, and I'm here to talk about mental health. I work primarily with children, and I'm just excited to be here to answer questions about mental health and the elderly.
Okay, well, thank you, Saba. I was actually going to ask you to introduce yourself a little bit, but you just did that yourself. So what drew you into the field of psychology and doing what you do?
So I have always had a passion for helping people, just getting myself out there. I used to be a nursing major, so I just love kind of working one-on-one with people. Mental health is something I'm super passionate about. I know that there's such a stigma sometimes around it, especially with populations, elderly, and just overall, I think that there's such a need for it. So that was kind of my what drew me in.
What would you say are some of the most rewarding aspects of your work?
So I work a lot with kids, and I think that just kind of I work with kids and parents. So alongside when I work with kids, I also work with the parents as well, just on like parent coaching and things like that. So I think it's very rewarding just kind of seeing kids progress, being that safety for a lot of people. A lot of times it's fun because people are like, oh, I've been waiting to come and see you. Like I needed to come talk and stuff. So that's always a good feeling, like being that comfort for someone, and just being there for people, giving them a safe space to talk, and giving parents the help and guidance that a lot of times they need, making people feel like they're not alone in their challenges. So there's a long list.
That's good. What would you say are some of the most common mental health issues that we see in the elderly age population?
So I feel like the big ones that stand out are definitely depression, anxiety, definitely dementia, sometimes even like substance use disorder, things like that. So especially when it comes to depression, just kind of like the loneliness and isolation piece can really be an effect that the elderly population go through, and things like that. When it comes to anxiety, there's definitely a lot of worries when it comes to like worrying about your health, worrying about your living situation, financial stress that you might, be a burden on someone else. So there's a lot of things that kind of come with that. Along with that, there's, definitely the dementia piece of it too, where you're experiencing some of that cognitive decline, some of that memory loss, and just things like that become really difficult with the elderly population specifically.
And kind of going off what you said about loneliness and depression being so profound in the elderly population, I think what we do here at Sahara is also so important in that end. Caregivers kind of become a source of socializing for the seniors, especially the ones that don't have any family. So
absolutely. Yeah. That's so important. And I think with elderly too, it's like you need that. I mean, humans need interaction. You need to socialize with people. You need to have people to talk to. And so that's really important. Yeah.
Okay. How would you say that mental health symptoms present differently in the elderly than they would for someone who's younger?
So I think it's interesting to look at a lot of times what the causes of a lot of these mental illnesses when it comes to the young versus the elderly. And I think a lot of times with individuals that are younger, it's very much related to their social life, their peers, their relationships, self-esteem, discovering their identity, versus for the elderly and anyone older. It kind of becomes a little bit more about the job stress, like the life transitions, things like that. And I also think with elderly as well, like they kind of tend to withdraw a little bit, so they can present a little bit more withdrawn. They might feel lonely. They might not feel like they have a safe space to have a healthy outlet. So a lot of times it just kind of, it just harvests inside in a way. Yeah.
And then I think even like their physical decline and then having all these illnesses probably takes a huge toll.
Oh, absolutely.
On them.
Yeah. A lot of the stress aches and body aches and things just from stress, you know?
Yeah. Also, just not being able to do the things that you're able to do before. I feel like I would have a hard time with that if I wasn't able to do things like I used to so easily.
Oh, yeah.
In the past.
Just like self-care, anything that people can do to help themselves feel better with their mental health. It's a lot harder for someone that's struggling with their, you know, physical health and things like that to accomplish those things.
Okay. And then I know we talked about this a little bit, but what impact does isolation have on an older person's mental well-being?
So there's a few of them, but I think one of the main ones is just a overall decrease in the quality of life. They tend to have much lower self-esteem. You know, they're not surrounded by people that are uplifting them or, you know, giving them the progress and boost that they need. It also leads to lower physical activity for elderly because it's less, you know, interaction, less getting up, you know, meeting people, moving around, things like that, which is definitely not like a healthy thing for anyone in the elderly population. Not having someone to lean on. Just an overall decline in their cognitive health as well, you know?
Okay, and then, so do you think that cognitive decline, which is common amongst the elderly, can be confused with mental illness? And then if so, how is that something that we can combat or tell the difference between?
Yeah, so that's a good question. Cognitive decline and mental illness, there's definitely some overlap there. When it comes to cognitive decline, you're looking more at memory, thinking, problem solving, day-to-day tasks, things like that they're completing, that they might have a difficult time with when it comes to cognitive decline. Whereas in mental health, when you're looking at mental illness, you're thinking more thoughts, behaviors, and feelings. So those are more so linked to mental illness.
Okay. So how would you say that grief and loss manifests in older adults, especially those who may have lost a spouse or a close relative or friend?
Yeah, so I think similar to how we all kind of go through the stages of grief, I think it's very much something that you know, all ages go through, whether that's going through sadness, anger, anxiety. A lot of times there's that guilt and shame where, like, you know, you're feeling, did I do enough for this person? Did I, you know, you're just reflecting on your past with them. A lot of times it can lead to a lot of sleep disturbances, maybe difficulty sleeping at night, isolation, just feeling like very depressed, withdrawn, not wanting to maybe socialize, feeling like a loss of motivation. I've seen that a lot where, you know, individuals are they're so upset about the loss, and, you know, it's very hard for them to continue to feel motivated and get out. And so that's a really important thing, is to make sure that they're still socializing, they're still, you know, talking with other people and things like that. And yeah, a lot of times too, they can just keep it in. They don't always process it right away. It can be kind of like that numbingness right from the start, where they just maybe they don't process it. Maybe it takes some time, so they might not react right away. Something like that. Yeah.
Okay. And then I feel like we kind of touched base on this already, but what are the most important emotional needs in the elderly?
Yeah, so I think that a sense of belonging and connection with people around them is probably the main one. There's a lot of others too, you know, like giving them that autonomy, that independence, you know, having them feel like they have a sense of purpose, security, things like that. But overall, that emotional connection is so important because they really feel like they have someone to lean on. And at that age, you need someone. You need support mentally, physically, in all aspects. So having that sense of security and just validation and help from someone is a really big one.
And then going back to the autonomy thing that you mentioned and independence, that's something that we push a lot from our caregivers because of the clients that they serve. A lot of times so many things are happening to them that are out of control. They can't control their physical decline. They can't control any illnesses that they're facing. So by giving them a chance to kind of take control of even little daily tasks throughout the day can be huge in promoting their independence and their sense of being, I think.
Oh, yeah. Yeah, definitely not taking away the things that they can do from them. You know, giving them things to do definitely helps them feel more confident in themselves as well. You know, like no one likes to be, you know, taken away their right to do the things that they've done and things like that. So I think that's a really important one, is just making them feel like they're still capable and they still have opportunities and, you know, not pushing this age and feeling that they're declining onto them.
So then how could you say that our caregivers can foster a sense of purpose in the lives of the clients that they serve?
Yeah, so I think just being respectful is a big one. So respecting the elderly, supporting their choices and helping them throughout what their needs and desires are. And along with that, just respecting their independence and also their experiences. So just kind of giving them the opportunity to be present and support them. I think too, just providing them with the confidence that they need and just being honest in communication and just being there for them as support.
So then what would you say, what role does validation play in supporting elderly clients?
Yeah, I think it plays a huge role in just increasing their self-esteem, helping them feel valued and heard, you know, like their concerns matter to someone. It's not like they're just being brushed off, you know, like any concerns that they have, any worries or difficulties, you're just validating their experiences. You're giving them a place to share what they're feeling, and you're allowing them to share without being judged. And you know, we all need that. It feels good to be validated.
Yeah, I was just gonna say
you
that,
know?
like regardless of age, I think everyone wants.
Of course, yeah. When you're having an issue or you're having a hard time and you seek support from someone, you want them to be, you know, validating your experiences. So
how would you say caregivers can identify early signs of emotional distress in their clients?
So I think it starts with a little bit of the behavioral patterns. So just becoming agitated, frustrated, maybe becoming withdrawn, agitated, or just refusing to, you know, want to do things.
So just like a change in their overall behavior, how they usually are, can be a sign of.
Yes. So in addition to that, anything verbal. So maybe like they're starting to have a lot of like negative self-talk about themselves, possibly talking about giving up, things like that. And a huge one also is physical. They might start giving up on, you know, hygiene and things like that. They might stop wanting to take care of themselves.
Yeah.
So those are all, it's all kind of linked together in a way where you look at how your emotions really play a role in your behaviors, your thoughts, your physical health, and it's all kind of combined into one. So yeah, I think that when there is an emotional response like that, you do tend to see a lot of behavioral, physical, and even verbal responses.
Which is also why we push our caregivers to report everything to their supervisor. You never know, their sudden outbursts or them not taking care of themselves could actually be an indicator of something bigger at play.
Oh, absolutely. There's a lot of times an underlying frustration and agitation that's present. Yes.
Well, what language or approaches should our caregivers use when they're talking to an elderly person about mental health and mental illness?
So I think it's important to be gentle with them. Definitely normalize what their experiences are, what they're going through. And also motivate them, you know, don't make them feel like you're pushing a specific diagnosis or anything like that. Like, bring up their concerns and validate them, and talk to them in a way where you're encouraging them, you're respecting their privacy. Those are important things. And just overall not making them feel like it's a mental illness or something that they're really struggling with, you know, using it as a way to positively encourage them and how you can help them and just better serve their needs.
So what strategies can caregivers use to help build trust with their clients? Because trust is also very important when caregiving.
No, absolutely. So I think a few of them are definitely to show up for your clients. So be a reliable person for them. Be someone that they can count on. Be calm and attentive. Active listening is great. They just a lot of times need someone to talk to. And in addition to that, I think it's important to remind them that what your role is, so that they can fully understand, you know, what you're there for, what you're there to do. And also, I think, like, just sharing a little bit about yourself. Sometimes it can be this whole idea that, oh, there's this person that's helping me and I don't know anything about them. And in a way, it's like, wouldn't you want to know something about the person that's you're spending so much time with, right? So, like, sharing things about yourself, like if you have stories, if you have relatives or family that, you know, have hobbies or things like that you would like to share or talk about, anything to kind of broach that relationship so that you can build something to connect on, or ask them about their experiences. I mean, they'll have plenty to talk to you about. So just small things like that show that you care about them, not like you're just there for the, you know, the work of it, but you're really truly caring.
And then going back to kind of how you mentioned letting them know what your role is as a caregiver, because I think a lot of times our clients don't realize that the caregivers are also there for companionship, and they're also there for their emotional well-being. Are there any simple daily practices that caregivers can take to help boost their clients' mood and emotional resilience?
Yeah, definitely. So I think one of them is to just stay active, definitely connecting with others, getting outside as much as they can, natural sunlight, things like that. In addition to that, I think it's really important that they continue with expressing their, like, love and interest for hobbies. So anything that they're into, whether that's knitting or crochet, anything that requires them to somewhat put their mind into something, give them something to do, an activity, puzzles, things to keep their brain going. And also, I think it's really important to just sit down and meditate with them, give them a chance to relax and do like a quiet meditation, a guided meditation. There's so many out there that you can find online or anywhere, really. Reflections are good, helping them to reflect on their day, reflect on things that maybe went well, things that maybe they need some help with, so that things maybe don't build up over time for the caregiver or the client. And then I think a good night's sleep. Sleep is definitely important for them. And then just like looking at overall diet, looking at making sure they're eating good foods for their body.
How can family members encourage their elderly loved ones to seek counseling or therapy?
So I think an important, it's to reduce the stigma, just kind of highlight the practical benefits that are, outweighing maybe some of the concerns. And I think another thing that's important too is to kind of understand, like, what are their concerns? Like, just kind of addressing those first and maybe seeing if there's some sort of underlying thing that we can maybe discuss to help them feel less worried about it.
What are some accessible mental health resources for the elderly?
Yeah, so there's definitely different types of senior in-home counseling services. They also have an organization called NAMI. They offer a hotline which has different support groups. You can also find support groups online as well that are free to join just for any different type of either mental illness or anything that you're kind of struggling with that you just need peer supports. And then, of course, there's always the 24/7 hotline that you can call for any emergent behavioral concerns or situations that might come up.
So now let's shift our focus a little bit to caregivers, because being a caregiver itself can take a toll on people. So what would you say are some signs that a caregiver might be experiencing burnout?
Yeah, definitely. It can be a lot for a caregiver as well. They can definitely experience similar emotions as far as being overwhelmed, definitely feeling maybe irritable at times, getting fatigued. Maybe they're low on sleep. Maybe they're feeling socially withdrawn just because they're so attached to their role. So they can also maybe start to feel a little bit of resentment. Sometimes if they're overworked or they're having a hard time setting boundaries, they can feel guilty. Maybe that they're not doing enough, or that they're not, or maybe even if there's a strain in the relationship between the caregiver and the client, maybe there's some pressure that's being put on, or things that are making them feel guilty. And also just maybe some neglect if they're maybe not taking care of themselves. They're just putting in all of their effort to take care of someone else, but they're not prioritizing their own time and their own health and things like that.
Yeah, and I think especially if you're taking care of someone who has a lot of like physical decline or are facing a lot of illnesses, you get caught up in their problems and their illnesses and tend to forget about yourself.
Yeah, absolutely.
And then how would you say that a caregiver's stress can impact the emotional environment for their client?
So I always think that environment is such a big role around the entire age group. So starting from when you're a child, even your parents and your environment play such a role on your emotions and your well-being. And the same thing follows you around your whole life, really. So whether that's your home environment, your work environment, and for seniors, if their caregivers are feeling emotionally stressed or anxious or, any of those feelings, it can really cause them to sort of feel that as well. They might feel anxious about the relationship. They might feel tension. They might feel like they're a burden. They might feel like there's a lot of conflict, or that they don't want to be, they don't feel safe.
Right.
So there can be a lot of effects to this, and then in that situation it's difficult because then both people are really struggling, and maybe there's a lack of communication on what the needs are, what resources can be found to help both individuals feel much better. And I think as far as the environment goes, similar to kids and anyone else, you kind of mirror your environment, right? So if there's stress and chaos, you kind of start to feel the stress and chaos in your mental well-being as well. So there's a correlation there. Yeah,
and I would imagine that for clients too, if they see that the person that cares for them is going through something themselves, they might be more hesitant in like expressing how they're feeling, because they might be thinking, like my caregiver's already going through so much, I don't want to pack on the load,
Exactly. Definitely.
What advice do you have for caregivers on setting a healthy emotional boundary with their clients?
Yeah, so I think it's important to just know your limits, know yourself, and know what's healthy for you and what's starting to feel like a lot. Don't be afraid to ask for help. There's so many resources out there that are there to help with burnout for caregivers and things like that. And also to practice, how can you be empathizing with this person without bringing their emotions into your life, without bringing, there's a fine line between how do you care for someone and how do you make it your entire personality,
Right.
your entire life's focus. So finding that balance between being an empathizing person, but also creating that emotional boundary for yourself as well. And I think also just the importance of scheduling breaks. It's really hard. I think sometimes we get really caught up in this cycle of working, and it should be prioritized to put breaks in your schedule too. To make sure that you're taking time off, you're taking mental and physical breaks, however you need, and just setting healthy boundaries for your own space. Yeah.
So to kind of close off this segment, if you could share one key takeaway for caregivers and family members that are supporting elderly loved ones, what would it be?
So I think that the importance of self-care, boundaries are very important. So just caring for yourself throughout the process. Don't let it become a situation where it's emotionally and physically draining for both sides, because then you're not benefiting anyone at that point. You're burnt out, and maybe they're feeling the tension of it. So really focusing on the communication, communicating with them, your needs and your space, and then also prioritizing if you need help, reaching out, seeking help, not having the mindset that, just because you're in this role that you have to do it all. You're given support and resources, so use them, I think. And just being patient and really focusing on creating an honest relationship, and not only with the caregiver, but with the client, just creating an honest relationship with yourself and them, to feel that trust and
Definitely.
sense of security. Yeah.
Definitely. And for our caregivers, some things to note is, as she was mentioning, it's important to take care of yourself so you can take care of your clients. And it's also really important to continue to report things to your supervisor. So anything that you notice, even the slightest thing, can be an indication of a bigger issue at play. So constantly being in communication with your supervisor, letting them know of things that you notice in your client. So thank you, Saba, for coming out and taking out the time to talk to us today. We really appreciate it.
Absolutely. Thank you so much for having me.